Okay. Good evening, ladies and gentlemen, and welcome to the World Medical Council Organizational Quality Excellence Awards 2019 Healthcare UAE Chapter. I am Nia, your host for the day. On behalf of World Medical Council BIS Events Management and on my personal behalf, I am honored to extend a warm welcome to all of you in this room today. World Medical Council is a non-profit organization designed for the continuous and conscious development of the medical industry. The Council works to spread the message of healthy living in our community through its strategic alliances and helps advance every facet of the medical industry and reflects its unique perspective to our society. I would like to first invite on stage Mr. Sohan Roy, an accomplished Hollywood director and a founder of World Medical Council, to deliver the presidential address. A creative designer by profession and a visionary by action, Sohan Roy is an accomplished performance-driven entrepreneur, poet, lyricist, and producer, and a proven leader who has been credited with pioneering innovations in movie, media, maritime, and medical industries. His first directorial Hollywood venture, Dam 999, was a thought-provoking movie on dams, its effect on human life. The movie was well appreciated and found its place in many national and international film circuits. The movie also garnered 5 Oscar selections in 3 categories, including Best Picture, Original Score, Original Songs, and he is also the founder director of Concept Indiewood, the 10 billion US dollar project to elevate the Indian film industry at par with Hollywood, author of Anukavyam, and founder, chairman, and CEO of Aries Group of Companies. Sir, I would request you to kindly address the gathering.
Hi, good evening. I'm basically a naval architect, a ship designer. But I believe that you're all from medical industry, but I'm also from a medical industry. Since I believe more engineers are working in the medical industry than doctors. Because behind every equipment what you are using today, every technology what you are using today, every software, whatever it is, there's a group of engineers behind it. That way, we engineers are a part of medical industry. For the last say around more than 6 years, we have been working, a group of engineers, we have been working to integrate the entire medical industry in the world. That is this project. This World Medical Council is also a part of that one, because every country got its own medical councils. But other than WHO, there is no single body where an industry can club together with a common vision. So WMC is working for with that goal. If you ask me what is our goal, WMC, what is my personal vision, I will say there should be a world without disease. There should be a world without where people can live without taking medicines. But is it possible? It's maybe an utopian idea. But if we try hard, we can achieve somewhere near to that. We are trying to give this message across the world where we can reduce our the worst condition of our health at least by 1% every year. If we can reduce, it is a great achievement. Because I am a part of the industry also. In our organization, what the target what we have set is every year our medical bill should be reduced by 10%. 10% reduction in the medical bill means the average health of the organization is going up. How is it possible? You need to put a lot of effort. You need to take care of your employees in a wider perspective. What we have done is, now we have our own in-house health management system where every employee is closely monitored. Their health is closely monitored by the organization. People who are in the critical limit, in the danger zone, there every month we take care of their health conditions. We make sure their health is going up and up. 4 years back, we we had a very bad experience, not 4 years back, around 5 years back. We lost 2 employees. When we analyzed, it was absolutely possible this health management system was in place. But once we put our entire employees into this track, not even a single casualty we could identify. We never faced it. Our number of lost working days because of the health issues drastically came down. This year, now we again improved or increased our target by including the parents also into the health management system. Because when we did a study, we understood that the main headache or main worry of the employees, it is the health condition of the parents. See, end of the day, the efficiency of the organization will increase only when the efficiency of the employees go up. To improve the efficiency of an employee, their mindset should be improved. When we did the study, we identified that there most of the people, because most of the parents are there in abroad, either in because most of our employees are from either India or Nepal, so they are all worried about the health condition over there. Now we started our own rejuvenation center where these parents can come. We identify the parents who are in the critical limit. We bring them, we take care of their health, we make a management system. There is an exclusive person to take care of all these things. I think by next year, our parents' health also will be drastically improved. This will actually, this is taking a big shoulder weight from our employees. They can more focus on their job. So I think next year will be a much better year for our organization. So we are trying to spread the same message to the entire world. If it is possible in our organization, it is possible in other organizations too. But thing is, when we send our people blindly to an organization like yours, what we expect is the best quality of service from your side. That's why this particular award we are looking into it. It is the responsibility of every organization, every medical organization, to make sure that the quality standard is also going up every year. Instead of giving more and more medicine to the patients, we need to you have to make sure that this patient requires the right medicine at the right time, at the right the procedure is being followed by the organization. When you are giving the right procedure, the end of the day, the patient is getting benefited. Because what we are facing nowadays, the biggest problem what we are facing is when we are sending a patient to a hospital. Before we used to spend only hardly 1 hour for the entire procedure. Now it has gone up to 4 hours, 5 hours. It is because already he's a patient, and the patient has to go and spend 4 hours, 5 hours in the hospital. It is nonsense. We need to work together. We need to we need to find out a solution for this kind of issues. Today we have a panel discussion here. We need to discuss all these things. We need to find out a solution. The entire thing is getting recorded. We have viewers from more than 110 countries now. So let us share this message to the entire world. So if you have any kind of ideas, please open up your mind, talk. Let us don't think that the entire program is limited to this small hall within these four walls. It will not limit. It is open to the entire world. So whatever your ideas, you please open up. Let us discuss. Let us record it. Let us document it. Let us find out a solution. And also, we are inviting the entire we have more than 20 organizations representatives here. So we invite all these organizations to become a part of our WMC, to join hands. Let us work together. Let us. There's a procedure to how to get the accreditation for your organization that our people will explain you. But before you leave, try to fill up the forms and make sure that you become the brand ambassadors for this vision, and you bring your entire organization, your staff, everyone under this WMC, so that in the coming years, WMC will be ruling the entire medical industry. Thank you very much.
Thank you, sir. I would like to call up next Dr. Vinod Thampi, the CEO of Ahalya Hospital and General Secretary of WMC, onto the stage and speak a few words, sir.
Good evening, ladies and gentlemen. Today, the 1st of July, is Doctors' Day being celebrated along the Republic of India, where it is to commemorate the birth of a pioneer physician who later became the Chief Minister of the state of West Bengal for 14 years consecutively, Dr. B.C. Roy. If you know the history of Dr. B.C. Roy, he has 3 distinctions which you can take for a quiz. Number 1, a physician who has become a chief minister, and the first one to do so after Indian independence in 1947. Second, a practitioner in the medical field and not in a non-clinical arena, who has been awarded the Bharat Ratna, which is the highest democratic award given by the Republic of India. And third, he was born and he died on the same day, July 1st. The only other person I searched was William Shakespeare, who had this fate on April 23rd. So, when we have the WMC conducting certain award functions, 2 months ago in the same auditorium, the WMC gave awards to the HR Professional Excellence, and we had nearly 30 to 35 representatives of various selected hospitals coming. So, myself and Mr. Sohan Roy, who is the Vice President of the organization, initially we thought, let us invite the best cardiologist of Emirates, or the best gastroenterologist, or the best surgeon. And then finally, we decided that there are people in back offices who do the role. And that is why precisely Mr. Sohan said, engineers are part of the medical industry, whether it is in radio diagnosis, laboratory services, or anywhere. You take the situation of UAE or any other country where hospitals and clinics were started 40 years ago. One of our panelists, Dr. She and her husband started a medical industry center 40 years ago. My managing director in Ahalya Medical Group, Dr. V.S. Gopal, started a clinic in 1980s. And everywhere it was the same replica. A doctor is there, a nurse is there, a pharmacist is there, a physiotherapist is there, a nursing assistant is there. Then when the crowd increases, another doctor is coming, another nurse is coming, another nursing assistant is coming. So the growth for the first 5 years to 10 years was just centered around medical professional. If the crowd was increasing and the demand was a surgeon, the surgeon joined, the operation theater technician joined, the anesthetist joined, the anesthesia technician joined, the CSSD, the sterilization unit joined. That also, everybody studied something in relation to medicine. Pharmacy came, the inpatient pharmacy came, so a cluster of pharmacists joined. Now, if you see so, you are all representing various organizations of different stature across the Emirates. If you take an organization with 1,000 employees, 60% and more are people who have taken their basic education outside the medical arena. We have quality department, we have customer care department, we have HR department, we have coding, we have medical insurance and front office. So much so that the crux of the business runs around the attitude of people whom the patient does not want to meet directly. The patient is happy if from the entrance level at the valet parking itself he is taken to the room of the cardiologist or the neurologist or he comes for a procedure. But then it is not so. And that is why we decided the focus of the awards are coming to non-medical practitioners. And the HR awards that we distributed 2 years ago invited a lot of discussion. It came in all the dailies and it is being telecast globally to around 100 plus countries. And today, that is why we have taken the focus to the quality department, so much so that the panel discussion following the video would incite certain discussions and we are a group of experts. And lastly, you think all of us are working together. What is the strength? We have people from different areas of hospital management, administration, etc. And suppose we are all working for one organization. I think that would be the best tribute that we can contribute to a promoter. I am sure that the invitations have been well reciprocated and we follow the time as far as our processes and procedures for the day are concerned. And thank you all for your patient attendance and hearing.
Thank you, sir. Now, to know more about the World Medical Council, let's just watch a small video presentation.
The modern healthcare industry is divided into many subsectors, depending on the multifaceted teams of trained professionals and paraprofessionals to meet the health needs of our world. From physicians to surgeons, paramedical officers to pharmacists, nurses to managers, administrators to underwriters to medical malpractice attorneys, marketeers to investors and shareholders of for-profit services, all contribute to this fastest growing industry. These professionals provide the best healthcare services for us from primary to secondary and tertiary levels. To improve access, coverage and the quality of health services, World Medical Council, WMC, a non-profit organization designed for the continuous and conscious development of the medical industry, has been initiated. Our aim is to support the field of medicine while developing a close-knit relationship among different medical associations and their related departments. World Medical Council aims to function at a local, national and international level to spread the message of healthy living in our community through strategic alliance and help advance every facet of the medical industry and reflect its unique perspective to our society. So what does it take to be a WMCN? Absolutely nothing. World Medical Council needs healthcare professionals to come together and contribute towards the advancement of the medical community and help us serve the world. As an associate, World Medical Council will open for you a complete new world with a wide array of opportunities. Through WMC, contribute your share towards the development aid, volunteer, and help support the delivery and financing of healthcare services among large segments of the population. World Medical Council invites you to associate with us and spread the message of healthy living, because together we can.
Quality is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives. Though we often connect quality with price, to find the exact metrics of healthcare is difficult, since even the most expensive healthcare systems have disappointing patient outcomes. Quality measures can take many forms, and these measures evaluate care across a full range of healthcare settings, from doctors' offices to imaging facilities to hospital systems, thus making quality an important and inevitable part of our healthcare system. Even though the process of developing meaningful quality measures and putting them into use is ongoing and will be refined over time, but as we collect and evaluate more data on quality, we'll be closer to ensuring that every individual gets the right care at the right time the first time. To discuss on this role of quality management in healthcare today and tomorrow, I invite our esteemed panel of experts to the dais. To start with the panel discussion, I invite our moderator, Mr. Dr. Vinod Thampi, CEO of Ahalya Hospital and General Secretary of WMC, on stage. Dr. Vinod Thampi is a well-known neurologist in Abu Dhabi who currently holds the position of CEO of Ahalya Medical Group. Before establishing Ahalya, he had been working with many reputed hospitals, including LLH Hospital, Shifa Al Jazeera Group, Apollo Hospital, etc. Some of his very interesting papers have also been published in various medical publications as well. Sir, could you please? Thank you.
A warm welcome again. We start the panel discussion. I would be introducing the panelists and welcome them to the stage. First, I welcome Mr. S.K. Sohan Roy, the chairman and founder of Aries Group of Concerns and the vice president of World Medical Council. You already heard from him with the presidential address. I call upon Dr. Mazin Abu Chaban, the medical director of Emirates Specialty Hospital, located in the Dubai Healthcare City, and he is a consultant in pediatrics and pediatric nephrology. Third, I would invite Ms. Mervat. She is the director of quality and patient safety at Al Zahra Private Hospital, Dubai. Please. I invite Dr. Meera Kurian. She is the medical director of Health to Home Group of Clinics and former medical director of Sunny Healthcare Group. Last but not the least, I invite Dr. Rasa Siddiqui, CEO of Arabian Healthcare and Ras Al Khaimah Hospital in RAK. This chair is for me. I am a panelist as well as a moderator, but I would prefer to operate from the dais here in the podium. So, what is quality? I have two experiences of quality myself. We spoke about, in a small introduction about me, where I was the CEO of Apollo Hospitals, Dhaka. I was a medical administrator and medical director of LLH Group of Hospitals in Abu Dhabi. Now I am the CEO of Ahalya Medical Group, running 4 hospitals, 20 medical centers, and 45 well-stocked pharmacies. But my element of quality is where I worked in Trivandrum Medical College in the emergency as a MBBS student, passed in gold medal, MD internal medicine. I passed it the first rank, DM in neurology, PhD, as well as MD in hospital administration. So none of the private organizations, I would say, rather than money, some fame, but the entire strength of standing here is with the Government Medical College in Trivandrum. I have also worked in Kottayam and Calicut, which are tier 2 towns of Kerala state. Second, the quality when a patient is there. I lost my father last year because of a nosocomial infection, and Klebsiella pneumonia was my enemy. So personally, I am worried about the quality of many happenings in a hospital, whether it is in the outpatient or whether it is inpatient services. And it is ubiquitously these problems are distributed. And rather than putting an autobiography, I would throw the questions to the panel and let us have a healthy interaction. And whatever question you would like to raise to the panel also is possible. So first, let us start with Mr. Sohan Roy. He is a businessman with offices and staff across 3 continents, and around 2,000 employees are under him. I don't want to ask the chairman and managing director of a group of concerns a very small question. So I ask him, number one, what is the level of expectation of treatment you and your employees would like to obtain from a hospital or a medical center of your choice?
I will start with my personal experience. A few years back, we were using a hospital here in Sharjah because our head office was very close to this building. So there was a hospital on top of that building, and we used to, in the Mubarak Center, we used to use that hospital for the consultation. So normally our staff, if some problem is there, they will just go there. They will finish everything in 20 minutes or 25 minutes. They will come back. We were all happy. So one day we decided, okay, the hospital gave us a proposal. Why can't you get into the insurance system? That time I was also taking my BP tablets. The cost of my BP tablets those days was 24 dirhams or something for 1 month. Then okay, we decided, okay, we will try for 1 year with the same budget what we used to spend for our patient. We signed a deal with the hospital. The moment we got into the insurance system, the entire system collapsed. Everyone started misusing it. My 24 dirham medical bill became 200, and immediately the doctor changed the medicine to some other new medicine. It cost 216 dirhams or something. And later I came to know that 100 dirhams goes to the hospital from that one. Every patient, every staff started misusing it. They simply going, because it's under insurance, they started misusing everything. So naturally, at the end of the day, the total medical bill went up by 500%. See, no insurance company is going to pay from their pocket. What will they do? The next year, their premium is going up accordingly. So we stopped there. We started our own in-house insurance system. We said, if you have a problem, you go there, you get it cured, and the company will immediately pay it. So the responsibility is not only from the hospital side, even the patients should make sure that they don't misuse, because insurance is a good scheme, but if you start misusing it, everything will collapse. Hospital, if they misuse it, the end of the day, who is going to pay? The employees, they are going to pay. In our system, not the employees, the employer is going to pay for that one. So that's why I am telling you, what we are expecting from a hospital is, when we are sending our people for your service, we need two things. Please don't give over medication. Second thing is, find out give a quality service. Make sure that the right procedure is being followed, and don't waste our valuable time. Because nowadays we are really, because Sharjah it is not mandatory to go for the insurance thing, but in Dubai it is mandatory. So half our staff, they are all Dubai visa holders. If there is a problem in Dubai, we are really worried, because we are afraid to send our staff to the hospital. If they are going there, minimum 4 hours, 5 hours, they are wasting it. So we need to have a solution to reduce this thing. Otherwise, each step, we cannot blame you, because when you are giving some recommendation, it has to be approved by the insurance companies. So we need to find out a solution for that one. This is the biggest headache we are facing right now.
Yeah, the next question, I would just request the mic to be passed to the extreme left to Dr. Raza Siddiqui. As the CEO who governs all the departments in your group of organizations and centered around Dubai and Ras Al Khaimah, as Mr. Sohan said, the devil of the insurance has spread from Abu Dhabi, where we are used to for the last 10 years. Now it has come as a double-edged weapon. How do you see the methodology that the quality department and the management has to change or take when an insurance-based system is being replaced from the pre-existent cash practice?
Thank you very much. Thank you very much, Dr. Sohan, for sharing your valuable experience. I will start rather from a very positive note. Forgive me for that. We are blessed. We are in a country where the leadership is committed to quality. And perhaps this is the only country in the world where almost every hospital has Joint Commission of US accreditation. Now, I would not like to take side of somebody or blame somebody. We are a young country. We are evolving. But the most important thing is that the commitment of leadership and the opinion makers is towards quality and patient safety. I would want this forum for a big round of applause for the leadership of this country for taking this initiative to have every hospital to have some kind of accreditation. Can we have a big round of applause for the leadership? Now, coming back, you know, quality is the single most important mainstay if we want to be in healthcare. I don't want to talk of percentages. We talk about zero defect. Like the inspiration or analogy is aviation industry, where the protocols have been set for many years, 100 years, towards zero defect. Because a pilot's single mistake can cause death of hundreds of people. In healthcare industry, similarly, we cannot afford that. Now it has to be, what we are practicing here is, you are the best person to say that we are practicing evidence-based medicine. And evidence-based medicine is documented, well-tried, and outcome-based. So all the hospitals slowly, if they have to have accreditation system, they have to have outcome-based practices. Now, insurance has come recently. Now, insurance definitely there is at the beginning, there is a disconnect. We run a hospital. To run a hospital, it costs minimum 3 million per year. That's the cost to run a hospital. Insurance companies have started selling policies for 500 dirhams. Now, I will talk about the statistics. Is one patient visits a general practitioner or a physician 5 times a year. You go to a smallest possible clinic, you will know with your experience, it doesn't cost 150 to 200 dirhams. 5 visits in a year itself costs 1,000 dirhams. So what are we talking about? The only thing is, very important fact, governments all over the world have not been able to run healthcare systems. It has to be privatized because healthcare is technology and and capital intensive industry. Today what is relevant, tomorrow it will not be relevant. Why should somebody like her invest into healthcare if she is going to make losses and do a charitable business? So there has to be a connect between the provider and the insurance. Because if she is not able to run a profitable business, she is going to close the shop. Who is going to take care of you? So I will not go to the extent of blaming anybody at this stage because it is a learning curve for everybody. But the biggest thing is that everybody is committed to quality. Over a period of time, it will happen. People talk of 2 pillars. I'm answering your question, sir. People talk of 2 pillars, quality and patient safety in healthcare, colleagues who are sitting here. We talk of 4 pillars now because insurance has come. Quality, patient safety, efficiency, and viability. If these things are not practiced, no healthcare provider will be able to provide the healthcare. I'll give you an example. We are committed to zero defect in Iraq hospital. The hospital was designed as per Joint Commission standards. Policies, procedures, protocols, everything was documented. We are providing international quality healthcare, American quality healthcare at Asian price because of our efficiencies. So it is the commitment of the leadership. I'll give you an example. We practice 0% hospital acquired infection. You were talking about it, doctor. This is the only hospital in the world where every door handle is disinfected every 2 hours. I have no business to pass on my infection to person who is walking into my hospital. Hand hygiene, we take utmost care. Wrong site operation, impossible. I don't think Dr. Gawar is the CEO of the hospital who is sitting here. We have hardly had 1% infection in 11 years. We have patients who are lying in our ICU for now 10 years, not a single bed sore on the body. Body is like a baby. So this is totally commitment of leadership to quality and patient safety. Efficiencies will come. We are on a learning curve. I would not go this far in blaming anybody, but I think all of us have to be on the same page of our commitment towards ultimate customer who is a patient. And if we don't deliver, we are going to lose it.
Thank you. And I put the next question to Dr. Mazin Abu Chaban. We always speak about JCI, the lion which comes once in 3 years. The promoter again spends. No employee is spending for the JCI. If you have a group of hospitals and one is accredited, there will be an inferiority feeling for the sister concerns. So automatically that also goes in for JCI accreditation and re-accreditation. My question to Dr. Mazin is, JCI, is it the end of quality? That means if a JCI accredits a medical center or a hospital, does it mean 100% safety and quality standards are adhered to? Please.
Bismillah ar-Rahman ar-Rahim. Actually, I have a small comment, if you would allow me, about the insurance and what we were speaking about the insurance. Actually, as we all know, the insurance is the future, and the insurance is, without the insurance, it will be very difficult to run the hospitals and to give the proper and ultimate service to our patients. But there is two missing rings which should be completed in the chain. The patient education and the medical service providers education about how to use the insurance and how not to misuse or abuse the insurance. Because what we notice now is service which is super excellent, and especially in our country, thanks to our leaders who have due to the quality and the wisdom in the healthcare, that they have made the insurance available to every citizen in this country, whether is a visitor or non-visitor. But we need to educate them how to use it. It is a blessing to have insurance, but take care. If this insurance is not well used, it will be again against all of us. So using the insurance in the proper way, and our colleagues how not to misuse and abuse the insurance by getting more money, because if you think on the short run, you will do it. But if you think on the long run, it will be against the institution and against the healthcare.
Yeah, that's right. So what about the JCI?
Yes, I will come to this. Actually, I believe that the quality in a hospital is the backbone of the hospital, and without the quality which organizes and coordinate and attach the whole teams together, there will be a big defect. It is not about JCI alone. If I'm working in a hospital just to get the accreditation of JCI, it means I'm a big failure. Because JCI can be, it will be getting it. If sooner or later it will be there with some notices, with some recommendation, it's okay. But our aim should not be JCI. Our aim should be the continuity of the quality. Quality should be our mind. Equality should be in our thinking. Equality should be in everyday work and everyday treating a patient. There should be I should be thinking of equality. Giving medication, I should be thinking of equality, and so should every health service provider should be thinking of that. If I'll make my goal JCI, it will be really a big failure. Equality has no boundaries. Equality should be spreading everywhere, and every year we are expecting from equality more and more and more and more achievement and more upward. To be able to guide us, we are as doctors, or we are as providing the service to the patients. Sometimes we don't think that much if there is nobody who is observing and guiding us to the best of the quality which we can give: safety, quality, efficiency, and the best teamwork to our patients.
Thank you for the insight. If you all have checked the JCI certificate that is issued, it only framed on the wall shows the audit, the particular facility has passed the international standards for patient safety and organizational management. JCI does only certify two. It is not an inspection. It is only an audit. I am sure that the JCI 6th version with 14 chapters for clinical as well as administrative ones are being checked periodically by all the participants. And there are areas of quality other than JCI and our commitment, which the next question is to Ms. Marwat. She's the director of Al Zahra Hospital Quality Department. So I just request you, madam, what are the KPIs that you follow and what are the delinquencies that you identify? Now, every meeting should have an outcome. Every management information report has to be having a, what do you call, a response. It can be suspension of an employee, termination of an employee, closing down of a department, changing the consultant, mutual transfer, putting him in another area where he is able to work with his minimum skills. Don't think every person coming and working in UAE is a Nobel laureate. Please.
Thank you very much. In fact, for measurement or KPIs, we have a very robust system at Al Zahra Hospital. We have at multiple levels, we have measurement and KPIs at multiple levels. We have strategic KPIs that are driven from the strategic plan, and we have projects. Each project have the milestones and have KPIs. And these are reported in the business meeting every 2 weeks. And we have the radar, so we can see the performance, how much we have performed, and where we are. Every 2 weeks in the business meeting, we discuss strategic KPIs. We have also departmental KPIs. For example, radiology department KPIs, anesthesia department KPIs. We have hospital-wide KPIs, like international patient safety goals, hand hygiene, infection control. These are monitored at the hospital-wide level. We have also physician-specific KPIs, and we have a very robust system where every physician in the hospital, except 2 departments now, we have 22 departments. We have physician-specific KPIs that we look at the clinical outcomes, process measures, and outcome measures for every physician based on the top 5 diagnoses he performed. And these KPIs, the OPPE, these KPIs are monitored on quarterly basis. For physician-specific KPIs, we have a balanced scorecard that the physician will receive every quarter. And that's the balanced scorecard have 4 elements. It has the ongoing physician performance evaluation scorecard. It has 4 elements. Documentation, because very important for insurance, for claims, and for JCIA. Professionalism. Under professionalism, we look at how the peer review evaluate the physician or the department. We look at attendance of meeting. We look at reports on time. We look at patient satisfaction index, happiness index, and we look at customer satisfaction. So these are under the professionalism, attendance of meeting, reporting on time, contributing to quality improvement, all that comes under professionalism, and the score is written by the CMO office is leading on that score. The third pillar of this balanced scorecard is physician-specific KPIs. These are measures that we audit every month. For example, for every department, for oncology, for thyroid surgery, we have 18 KPIs. And that is that audit, clinical audit, is done by the surgical department, by our oncology department, and the validator is from the oncology, a surgeon who validate the results. And that will contribute to the physician-specific KPIs. So these 3 pillars, the addition of the score he got for documentation, professionalism, and for specific clinical outcomes, these 3 are added, will end up with an index or a weight, 0.8 out of 1. 80%, 90%, 50%. That 50% will be multiplied by the productivity. And that would be either addition or a reduction in the total remuneration the physician will be taking. So if they don't improve their input, the money will be infected.
Thank you. And this is precisely, see, when we come here to make fortune, unless the money purse is touched, nobody will improve. We thank our benevolent rulers of this country for giving us an opportunity. We thank our promoter for giving us the job and promotions and increments and other facilities. But then, to the employee, if only his salary is cut or he deserves punitive action that it is provided, only then he will improve. But if one person suffers such a loss, all others are getting alerted. So I just, a small comment.
I do not agree 100%. It's not always about punishment, okay? We have very, very open culture at Al Zahra Hospital, and we are very positive. Even the percentage of documentation versus the other parameters, pillars in the balanced scorecard was done with physicians' engagement, and they decided together what are we going to put for documentation. Documentation is linked to payment from insurance, full documentation, and it's linked to joint commission. So that percentages was put in alignment with physicians. So we told them that if you have more compliments, if you achieve 100%, you have compliments, you have over contribution, you can have +5. So the index will be 120 instead of 1. So instead of getting payment 10,000, you will get 15. Even we have an agreement maximum was 10, you can get up to 15 if you have more compliments, extra projects, extra achievements, you will get extra payment than you expect.
Yeah,
So
I
it's
was
not
never
only reduction.
advocating that from tomorrow onwards you should start reprimanding and put punitive actions. Not like that. The fear will make them work better. See, the thing is, in quality, what happens
Don't
is
agree.
HR will give the number of days the patient has worked or the time the staff has worked. It is a numerical.
Yeah.
The medical records department will say this doctor has seen 400 patients, 10 surgeries, 25 CTs. It is a numerical. The revenue cycle management, they will say this doctor has taken X salary, he is contributing this. This is a numerical. What I was telling is precisely what she said in another method. Your habits has to be translated to a number. Honesty has a number, punctuality has a number, and that is where the delinquency reports will make the staff work. Otherwise, what happens? My duty is 7 to 3. 7 o'clock I punch in, 3 o'clock I go back. I am detached from the organization because my duty is only patient care. I am a practicing neurologist. If I do like that, I detach from the institution at 3 p.m. I am free. I don't have any numerical. I am not looking to any clinical practice guidelines. I am not contributing anything physically or mentally. Next day morning again, I brush my teeth and punch. So this situation will change provided the quality department brings up so many numericals which are translation of your habits into numbers. I request the last panelist, Miss Dr. Meera Kurian, to answer a important question what you are all asking for. What are the common patient complaints? As Mr. Sohan Roy said, the employee is most happy. In 15 minutes consultation, he is spending 5 hours in the hospital, gets 2 days sick leave. Great. He is at a loss because he is paying him hourly, whereas the other fellow has escaped that day's work. So what are the patient complaints that you attend to?
Good evening, all of you. Uh, that's the last thing I want to actually face patient complaints because that's the most we get. But we have to balance both. So when I came to this country in 1990, I was planning to work in the hospital because my parents were both doctors in the government hospital. But unfortunately, Mr. Saddam Hussein decided to invade Kuwait, and so they stopped all the appointments. So we were forced to start a medical center, which we didn't want to initially. So we didn't know ABC of how to conduct a private medical center. We started with me, my husband, a nurse, like you said, and slowly expanded. So initially, what we thought about is how to make a patient happy as soon as he steps into the clinic, because most of the clinic in Sharjah were very, very bad hygiene. You know, if you know then the British Bank of Middle East, the building, you couldn't even step into any of the clinics. It was so badly managed. So the first thing we decided is to reduce complaint is to make a beautiful clinic. You know, very hygienic, very patient friendly, and so that reduced the complaints, because that's the first thing they say is like, oh, it's so neat. So the complaint fell down. So gradually over the last 29 years, what we realized is keeping a quality makes the complaints less, because the patient feels that we care for them. You know, we care for their comfort and good words. So even though sometimes the patient has to wait for a long time, they are not very, very hostile towards us, except few, because we make sure the comfort zone is good. They're given water, or children are kept active with some activity center. So the main complaints would be, one is waiting period, which is very important. Second is the staff, how they behave towards the patients. Some of them could be very rude, so it has to be attended to, because as soon as we get a complaint, we make sure that the staff is compliant with the patient's needs. Because we had one of the biggest footfalls in the private sector in UAE, because we started off with me and my husband, and over the years we had about 250, 300 doctors working for us. We had about 11 clinics, 9 pharmacies. So the complaints were a lot. But when compared to the compliments, it was less. And the patients had the doctors had to be compassionate. We were very particular about one word: compassion. The moment no doctors were allowed to be rude to the patients, because the patients come at the most vulnerable. So we educate the doctors about how to conduct the code of conduct, because we ourselves are in a lot of stress as doctors. Sometimes the patients could be very um, irritating. But if you give them the compassion and a ear, I think many complaints comes down. So every hospital, every staff, an important word of less complaint is compassion. Please be compassionate, all of you, not just the doctors. And quality, of course, hygiene. So sometimes they are very finicky. Many of the patients are very finicky about hygiene, especially with procedures. So we used to get some complaints. So we used to, again, train the staff nurses, because some of them didn't know ABC of hygiene. We take them because they have license, and then they come, and we had to teach them ABC of hygiene. So these are the main complaints of in a private sector, in a clinic, because we didn't have a hospital. So our complaints were rather more at that stage where they come in, or they have to wait, because some of the doctors are very popular. So sometimes 2-3 hours waiting with a sick child is not a joke. So we try to manage that. And also how the nurses give injections to the patients, very important. Sometimes we have to give a small vaccination. So we train this, because the mothers are so much on the edge when it comes to their children. So again, compassion, caring, good words, keeping the environment bright, healthy, and neat, and also alerting to emergencies. Sometimes we do get emergencies in the private sector, like patients can collapse, they can have come with a chest pain. So how fast you act on that, it's very important, because everybody panics, including the doctor. But the moment you start doing it in a cool way and know all the protocols about whom to call, where to send, what to do, you get a very good feedback after that. Like, you really took care of us. So private sector doesn't, clinics do not really have major issues like the hospitals. I am so glad I'm out of that, actually, because I am a physician who believes, like Mr. Sohan just said, to have a healthy population. My focus is on health, not on diseases. I'm a physician. I've seen the kind of percentage of diseases going up, and the ratio of the age group coming down. And we as physicians sometimes have still got to come in terms with the fact that we are just giving medicines and not curing. So I took the next step of starting with health, and that changed my life, actually, because changed my life personally, and treating the patients with the proper lifestyle, the proper food. I believe in whole plant-based diet. I'm a vegan. I don't promote veganism, but I wish people would at least follow that for 3 months and see how they reverse most of their diseases. I reversed my diabetes, which I didn't know I had. My fasting was 265, my random was 350. Just by tweaking my whole food habits without a single tablet, I'm now diabetes free. So if I can do it to myself, that's the quality I would love to give to my patients. I have reversed my whole aging process with that. I have lost about 20 kilos in the last 2 years without any exercise, any meditation, any yoga, with just food. So these are the quality things I'm now more interested in promoting. And the moment you start promoting good health, the insurance also are more happy, because you tend to do less investigation. In the US now, if you are a whole plant-based diet patient, your premium comes down, actually, your insurance. They know that you're not going to be sicker than you were before. You are going to improve. So these are things which we can show, and more than the complaints, I would just put these things forward because I want people to be aware more on the, it's general population, not just doctors. Everybody should know that we have to look at health and not at illness. The moment you look at illness, you look at insurance, you look at everything else, and you are stuck in a quagmire whether you cannot get out of it. So look at health, be healthy, and you will get less complaints from your peers, your patients, and your institute.
Thank
Wherever
you for
are.
your
Thank you.
advice as well as sentiments. Sir William Osler said, a good doctor treats the disease, whereas a great doctor treats the patient who has the disease. A good doctor kills Salmonella typhi, whereas a great doctor cures the patient of typhoid fever. I hope the slogan you have understood, and the house is now open for discussion. All the panelists are available. You can throw any question to any one of us, and after that we go for the award distribution ceremony. Please, kindly introduce yourself and you can speak.
Thank you very much. I am Ibrahim Al-Thubaiti. I'm a neurosurgeon, Sulaiman Al-Habib Hospital. I enjoyed your talk so much, and I learned from it, actually. It's a very healthy discussion. But I hear very rosy and nice talks, and it's nice when you see, see the, for example, the GCI, very nice, 1, 2, 3, 4, you can implement them dandy 2 days and everybody is happy. But in the real life, it's not that way. I think one word, the key of quality is a quality of employee. Don't accept quality from a cheap employee, or from any certificate, or if anybody passed the test here or the certificate from the DHA, and you can just take. So the key is a quality of employee, period. For example, I was in Riyadh taking care of the M&M department. And believe me, the same mistake comes from 1 to 3 persons in the hospital. Doesn't come from everybody. So it's a quality of employee. Thank you.
So what the neurosurgeon has said is quality goes hand in hand with training. JCI comes once in 3 years. Training has to be given to the right people at frequent intervals. So the medical directors as well as the quality HODs have to take reasonable interest in calling the right person. To a perfect man, don't give him again training. Spot them. I said you have to invite the people by name. Suppose there are 50 doctors in a hospital and the delinquency report shows only 15 people of them need to be trained, means identify the 15. Let others also know that the other people are surviving well and you are on grey zones. Any other question, please?
My name is Dr. Gower. I'm the Chief Executive of RAK Hospital. I have the pleasure of working for Dr. Raza Siddiqui. I couldn't agree more with you, the neurosurgeon. I didn't get your name. I really agree with you, because the buy-in of your staff, that is actually what makes the cookie crumble. And I always say, you were asked a question about the Joint Commission is at the end of the day. Of course not, because our slogan is quality, real quality, is doing the right thing without that anyone is checking you, so that your systems are in place. And the buy-in of your staff, that is really what makes all the difference. So about training, it's not only about training, it is also to give your staff really the feeling that they first of all, that they make a difference, and that they're not stuck in a certain position. Give everyone a goal. Give everyone the possibility also to develop. Give them a career possibility. Identify, and this is one of my KPIs for that matter, to identify in the hospital, within the staff, that everyone gets, including myself, gets the opportunity of developing one more skill within that year. And that's one of the KPIs we are measuring. And that actually motivates your staff to get that feeling across. And your happy staff makes your happy customer. You don't have to worry about it. So I agree with you. Thank you.
Thank you. And any more questions or comments, please?
Hi, I'm Dr. Vineet from Sulaiman Al-Habib Hospital. and I'm a quality head there. In continuation of Mr. Sohan and yourself, when we said that it's not about only the medical people, it's all about the other people behind the scenes who carry equal weightage for the quality. Now, we believe that quality is not treating a patient at the bed. It starts from doorstep to bedside. Now, when we say an example of a doorstep, a patient who's sick, who reaches the hospital and the valet parking is there. And this valet parking greets him with a great smile and he says, please don't bother about yourself, your car, I will take care. Now that's a first impression, that's a quality he's starting. Now he comes next to the step of a receptionist. Now suddenly the receptionist is sitting down and said, yes, what can I do for you? So what he has done, this receptionist, he has spoiled the good quality of the valet parking. Now when we say a quality, it's a journey from the doorstep. When he reaches some medication, he takes the consultation. Every step, the insurance person, they have, as he said, employee, which means a good employee who takes care of quality in every step. That's what is required. In continuation of all is this, the machines, the biomedical, they play an important role in taking care of the life support of the patient, which has an equal important role. Talking to about taking care of the patient, for the doctors, I'm a doctor, I'm an orthopedic surgeon. So for a doctor, to be a good speaker, you have to be a good audience, which means when a patient comes to you, listen, listen, and listen. 50% problem gets solved because the patient feels I've been listened to, my problem. And then you start speaking about the patient. And that's what I feel should be the one.
That is a very important point because when the cash practice is there, it is manuscript many a time. Electronic medical records definitely will creep in. I'm not sure about the entire spread of medical centers here. Now what happens is, as very clearly doctor has mentioned, the moment the patient comes, the first two questions, what is his insurance card? The man white. This is the attitude. The man tikka. Good morning, sir. That should not happen. Second, everything is pleasant. Valet parking is pleasant. Language is conversant. The patient has been brought to your seat right on time. The KPI is met with, but the doctor is not talking anything. He's sitting there. He is only behaving like a typist. So this is where each person has to help the patient come in and go back. Everything is done. There is 2 hours waiting in the pharmacy. Again, it is spoiled. He will give the complaint. So this is where it is a very, very tricky situation. And there is no end to the type of complaints. Previously, when the doctor, the patient and the nurse was there, either his behavior is bad or his diagnosis is bad. Now, so many people are there. They know where to give a complaint to HR, where to give complaint to quality, when to give complaint to the head of the institution or to the police. So we have so much of confrontations which are quiescent, and we have to be aware of what all could be happen and behave very, very, very positively.
Now, one more thing. See, 15 years back, when I used to go to a doctor, he used to look at me and we talk and thing. Nowadays, doctor's look is on the monitor. He is typing something and he's just listening what I am saying. This makes a big difference, actually. Yeah.
Any other question, please?
Thank you. I'm Riaz Khan, CEO of International Modern Hospital. I think one of the things which makes quality complete is the 360-degree journey of the quality. And I think we have maybe just out of time schedule missed on one point, that what do we learn out of the feedback mechanism and how much we are investing in learning from our mistakes and the people's feedback. So that is one thing which I consider as a very important segment of the journey of quality, that if you have a robust feedback mechanism wherein it is adequately addressed, it is responded, the closures are done effectively, and you learn out of those mistakes, that will improve on your journey of quality. Thank you.
fact, Zahra, we are very strong in measurement, and one of the KPIs, one of the things or initiatives we had, it's stakeholders. We have 360 evaluation. We have for Dr. Muhaimin, our CEO, we have done the 360 evaluation, and for the executive team. And now part of the OPPE is the professionalism, where all the head of departments will be evaluated by their peers as part of their evaluation within the system. So this will be implemented from this year. We have peer evaluation for all head of departments. Please.
Sorry, my name is Mohammed Munas. I'm a director of RCM from Salman Habib Hospital. I thought it's too much to take it because it's so much of blame for insurance. Just a word. I mean, just respond to Dr. Sohan Roy. I find most of the complaints and the delay coming in the hospital for an insurance person when it comes to insurance, where there is no proper understanding on the insurance that they carry. I mean, patient comes in with a card assuming that everything and anything is possible. So as a company, as a owner of the policy, they buy a policy, they don't really explain the benefits it carries to their employees. So I think if they explain it, what is in the policy, so that you don't having a car of a Corolla and not expecting to drive in a Ferrari speed. I mean, you explain them what you are buying, what you are paying for, so that there won't be no delays. The coverage will be explained, so expectations will be according to the policy what they bought. So that I think explaining the policy what they are buying and what they are paying for to the employees, I think will also make the service the possible.
Yeah, it is a very right situation because 3 days ago, I am practicing in Ahaliya Hospital, Musafa, which is a flagship hospital, 200 beds, cath lab, MRI, CVTS surgery, everything is there. A patient came to me with numbness of one hand for 3 months, and I just wanted to do a nerve conduction study of one hand and a few tests like RBS, calcium, and vitamin B12. All of you can understand what I'm aiming at. And immediately, my nurse come and tells, please, I don't think everything is possible. And she said, the limit is 150. So in front of the patient, he requires median nerve and ulnar nerve. And this basic test, I never included even CBC. It is not required. So within 150, now I am coming and thinking in front of the patient. Already it is put in the EMR. So I cannot cut median nerve. So within one nerve I checked, only median nerve. CTS you have to compare median and ulnar. And there is an international protocol for nerve conduction studies. So I put one median nerve and cut the vitamin B12 and sent. Again, the sister is coming back. Sir, 150 is the limit, but 140 is your consultation. That means for 10 dirham. See, this is the situation where, see, if I get infuriated in my company, what will happen to others? See, the thing is, so I kept quiet because we cannot insult the patient. 10 dirham, I don't know what service I can give. So then I just wrote a neurobion and sent him because I never criticized why it is not possible. I cannot say that I forgot nerve conduction study or the company doesn't have it. In 150 dirham, 140 is the consultation. I cannot refer to ortho also because that fellow also will have 150 and again 140 goes for consultation. So purposeless consultations are also happening. And this fellow took sick leave and went away. So such insurances, I think the company owners should not buy. Just have a diligence.
I think there is no problem with the insurance. I think the problem with accepting those kind of insurance to your hospital. So you need to choose and define what kind of an insurance for your prices that you can serve. So when you sign on anything and everything with the insurance company, these kind of situations you will end up with actually.
Yeah, I was just giving an example where in that chair, real-time situation, you cannot do anything. But give him a pleasant exit. If any other question is there, we'll...
Regarding insurance, just I would like to add that because of the rejections in insurance, sometimes because of the DRG coming forward for Dubai, you'll be happy. It will not be exploiting the insurance companies. Also, what we have done an agreement with Think Research, and now we are working on order sets. So if anybody comes with a certain diagnosis, all these like diagnostic procedures will be highlighted for you that based on the best practice, and that will be your best advocate when you negotiate with insurance companies. This is that the international standards say that this test should be done, and that helped us a lot in negotiation with the insurance, because you don't want to be blamed by the HA if you didn't do the test that are required, and at the same time you don't want rejections from insurance. So with order sets, we have international based order sets, international practice order sets. So it will tell you, based for this diagnosis, these are all the tests that you should do: the CBC, the X-ray, then this is a second level investigation or third level investigations, and that was very helpful. But
Yeah,
we are
and,
in the process now, still working forward on the process.
Yeah, agreed.
With the project.
One more situation is there. I told the example where I cannot move. The second example is he can move, but he's stuck. That means he has exhausted his pharmacy quota. He can do whatever. He can do angioplasty, he can do hip replacement, any number of consultations, but his pharmacy quota is finished. After doing all these things, you can give him tea and send him back. You have to give pharmacy also. So the thing is, patient is also overutilizing. He is going to different facilities, taking unwanted antibiotics, taking medicine for his friends. He is going on annual leave, taking medicines for his mother and father. See, these things are getting passed. Doctors are not to be blamed full time. But the thing is, for him finally, all this is possible. Card is good, but pharmacy limit is finished till the closure of the insurance.
I have a last concern. One is, if I have a problem today, I need to consult a specialist, I should do it today. Thing is, nowadays, it takes 1 week to get an appointment. What is the use of meeting a doctor after 1 week? Because I faced the same thing with one of my daughters, not here actually, it is in UK. She got an appointment after 1 week or 2 weeks. And we consulted other doctors and we got the medicine name also, but she cannot go to the pharmacy and get the medicine. It's a big headache.
Yeah, it is well taken. Even though it is a promotion, it is well taken. I wanted that facility.
Again, we're back to the quality of the employee. Similarly, in the insurance company, when you send the report to the insurance company, they are MD doctors. He doesn't know what he's reading. For example, I sent him that the patient having a temporal lobe epilepsy with mesotemporal sclerosis need to be resected. He doesn't know what is temporal lobe epilepsy. So he said, send back, no, this is epilepsy genetics. He doesn't know what he's reading. Again, back to the quality of the physician there. He doesn't know what he's reading. Back, then the patient is angry and the whole system is upset.
Yeah, see, the thing is, the system of appointment slotting, technically you require 10 minutes, but we give appointments at half an hour. Then the front desk will say the appointment is closed. I have been practicing neurology for 21 years, and I have never seen a patient on appointment. The patient has to walk in. It is my principle. I have not translated it into any other department. I have worked in United States of America. There also, in Texas, when this situation comes, at least if somebody wants a friend to be seen, I can immediately call up my colleague and say, give one appointment. There should be humanitarian consideration in that situation. A doctor may spend some more time or cut short an appointment. There will be cancellations. So it is a working principle, whether you want to see only appointments or 50% of your time appointments and 50% of time walk-ins, but that is not an issue with the quality. If the patient comes with a problem, then only we start the activity. So if any other, please madam, and after this question, we will wind up the session and we start the award functions.
Just coming back from insurance to quality, I think it's very important to develop a non-punitive culture in the organization. And when we talk about zero defects in an organization, from quality perspective, it's not comfort time, it's alarm time. It could be that there's under-reporting in the organization. That's just a comment from me, and thank you very much.
See, the concept of the punitive aspect is not to threaten anybody. The thing is, in Abu Dhabi Emirate, we have been using this insurance-based medical reimbursement system for 9 to 10 years, so much so that we know where the lacuna is. Suppose I am working in a hospital for 2 years. Now this insurance has come here, it is spreading across the Emirates. Now what happens is, my files can be audited up to 5 years, and then the money can be taken back. I may be the best employee for 2 years and I leave this organization, go and join another organization, again create havoc there. So the thing is, once you are buying a new dog, tame it properly rather than tame a wild animal. So that is it. What I'm actually telling is, in the revenue cycle management, this is a huge problem. Some people are laughing, all of them for Abu Dhabi. Thank you all.
To conclude, I want to, because from an entrepreneur point of view, I want to tell you, see, when we work out our medical budget annually, we are not only working out the entire medical bills or the insurance cost, we are working out the number of lost working days, because the medical leave is what you are offering. So when a patient is coming, you can simply write 2 days, 3 days off. But end of the day, we need to work out the lost working days. Okay, thank you.
Thank you. We conclude the panel discussion, and the MC is back for the award ceremony.
Thank you. So thank you, ladies and gentlemen. I believe that was an extremely exciting discussion, and I hope you all enjoyed that. So without any further ado, let's begin with our WMC Organizational Quality Excellence Awards 2019 Healthcare UAE Chapter. WMC Organizational Quality Excellence Awards 2019 Healthcare UAE Chapter is being organized to recognize the achievements of the industry's most outstanding performers and celebrate their success in international platform. We aim to highlight, honor, and celebrate path-breaking achievements of organizations who have demonstrated exemplary leadership towards driving organizational and team effectiveness through human capital management, diversity, and strategic planning. Now let's see who our first set of winners are. To present the award, I would like to invite Mr. Sohan Roy onto the stage, please. Starting off, our first award category is Excellence in Employee Satisfaction. This award acknowledges companies who value their employees and take exceptional efforts to creating an engaging workplace. And the winner is NMC Specialty Hospital. A huge round of applause. Thank you. To receive this award, I would like to invite on stage Dr. Manoj Kumar Verma, Medical Director, NMC Specialty Hospital, and Dr. Kamran Tagdis, General Manager, NMC Specialty Hospital. NMC Healthcare is the largest private healthcare company in UAE and ranks amongst the leading fertility services providers in the world. I would kindly request the winners to please head to the studio for individual photographs. Thank you. Leading integrated healthcare provider is our next award category. This award shall recognize an organization that has incorporated medical specialties and cost-effective health delivery measures in their healthcare system. And the winner is Aster DM Healthcare. To receive this award, I would like to invite on stage Dr. Nisha Nair, Senior Manager Quality and Medical Affairs, and Ms. Prema Paul, Senior Manager Quality, and Ms. Neetu Thampi, Quality Manager. As one of the fastest and largest conglomerates in MENA region, Aster DM Healthcare covers full spectrum of healthcare services. May I please request the winners? Yes, thank you. Thank you and congratulations, Aster DM. Excellence in Premium Healthcare is our next award category, and this will be bestowed upon an organization that has offered critical contributions and services to industry and provide premier healthcare services to their patients. And the winner is RAK Hospital. RAK Hospital, I invite Dr. Raza Siddiqui and the Executive Director of Arabian Healthcare Group, and Dr. Jean-Marc Goer, CEO of RAK Hospital, to kindly join us on stage and receive the award. Thank you and congratulations, sir. Our next award category, Excellence in Patient Care, recognize organizations that focus improving patient care through education, innovation, research, and clinical practice. And the winner is Zuleika Hospital. To receive this award, I'd like to invite on stage Dr. Rajini Ashok, Senior Director Quality and Specialist Physician of Zuleika Group. Thank you, ma'am. And congratulations. Moving on, our next award category is Excellence in Empowering Health and Wellness. This award honors and recognizes an organization that employs its resources and services to increase quality healthcare access to communities and individuals who need it the most. And the winner is Emirates Specialty Hospital. And I would like to invite Dr. Mazin Abu Shaban, Medical Director, and Mr. Reggie Paul, Finance Director, and Ms. Shifna Kader, Senior Quality Executive, on stage. As one of the prominent multi-specialty hospitals in the region, Emirates Specialty Hospital is proud to set new standards for result-driven treatment, personalized care, and passionate expertise. Thank you and congratulations, Emirates Specialty Hospital. Our very next award category is Excellence in Bariatric Surgery. This award recognizes an organization who exemplifies compassion and dedication and care of the metabolic and bariatric surgery patient, as well as executes the visions and goals of the integrated health science action. And the winner is Al Zahra Hospital, Dubai. I would like to invite on stage Mr. Merwad Mansour and Director of Quality and Dr. Mohammed Farhan Sher, HR Director. I apologize for that. Al Zahra Hospital Dubai has been designed and developed to provide premium medical care and comfort with modern equipment and team of professional doctors. Thank you and congratulations, Al Zahra Hospital. Leading tertiary care service provider is our next award category. This award recognizes an organization that commits to provide the best health care for locals and residents of the region. And the winner is Burjeel Hospital. I would like to invite on stage Dr. Shaini Narayanan, Quality Manager. Burjeel Hospital is Abu Dhabi's premium private healthcare facility providing world-class, specialized, and superior healthcare complemented by a warm, personalized human touch to the growing population of Emirate of Dubai, Abu Dhabi. Thank you and congratulations. Best CSR Initiative. Healthcare is our next award category. This award shall be bestowed upon an organization that has executed various programs which focus on preventing diseases, promoting good health, and strengthening of health systems. And the award for this category goes to Ahalya Hospital, Hamdan Street. I would like to welcome Dr. Sangeeta Sharma, Medical Director, and Ms. Srividya, Medical Administrator, Manager. Thank you. Established in Abu Dhabi as an ordinary GP clinic in 1984, Ahalya has a pride of place as one of the best hospitals in the UAE. Thank you and congratulations, Ahalya Hospital. Our next award category is Excellence in Ophthalmology. This award is to recognize an organization that focuses on providing equitable and quality eye care to all sections of society. And the winner is Moorfields Eye Hospital, Dubai. To receive this award, I would like to invite on stage Maha Abu Ghali, Marketing and Business Development Director, and Emma Smith, CPHQ, or Orthoptist and Quality and Risk Management Officer. Moorfields Eye Hospital Dubai is the first overseas branch of Moorfields Eye Hospital, which was founded in 1804 and opened in 1805 in London. It is the largest eye care facility in Europe and has been treating eye diseases for over 200 years. Thank you and congratulations, Moorfield. May I please ask you ladies to... Yes, thank you so much. Excellence in Holistic Healthcare is our next award category. This award recognizes an organization that operates within the fields of holistic and alternative complementary medicine. The winner is LLH Hospital Abu Dhabi. I would like to invite Mr. Anas K, Regional Manager, HR, and Mr. Ahmed Sahib, Quality Manager, to kindly join us on stage. LLH Hospital was born out of a desire to provide cost-effective yet specialized and superior quality healthcare services, complemented by personalized care and individual attention to each patient, with an unparalleled passion and commitment to serve the medical needs of the growing population of the Emirate of Abu Dhabi. Thank you, sirs, and congratulations. Now let us watch the next set of awards on the screen coming your way. May I please request Mr. Sohan Roy to come to the stage again? Thank you. Excellence in Keyhole Surgery is our next award category. This award shall be bestowed upon an organization that has the capability of providing treatment to all types of medical and surgical emergencies. And the winner of this category is International Modern Hospital. I would like to invite on stage Mr. Riaz Khan, CEO, and Ms. Remya Venugopalan, GM Operations. International Modern Hospital is an up-to-date private general hospital which offers a variety of services with multiple specialties in all private room inpatient facility. Thank you and congratulations, International Modern Hospital. Excellence in surgical treatment for epilepsy is our next award category. This award shall be bestowed upon an organization that focuses on curing and treating epilepsy patients through intricate surgical procedures, exercising focus on seizure itself. And the winner is Dr. Sulaiman Al Habib Hospital. I would like to invite on stage Dr. Ibrahim, who started the surgical intervention of epilepsy, and Dr. Vineeth, quality head, onto the stage. With a vision to be the most trusted healthcare provider in medical excellence and patient experience globally, Dr. Sulaiman Al Habib Medical Group has become the largest provider of comprehensive healthcare services in the Middle East. Thank you, sir, and congratulations. Moving on. Our next category is Initiative in Women Empowerment. This award is to recognize an organization who has the initiative to empower women to help them beat the diseases prevailing in our society. And the winner is Al Bustan Specialty Hospital, Abu Dhabi. To receive this award, I would like to request Ms. Shaina, Medical Administration Manager, to kindly join us on stage. Al Bustan Specialty Hospital is a multi-specialty hospital excelling in providing the best of patient care. Thank you, ma'am. Congratulations, Al Bustan Specialty Hospital. Our very next award is Excellence in Hospitality Services. This award recognizes an organization that has been working continuously to maintain a positive environment for their team and deliver top-notch health services to its customers. And the winner is Meteor 24/7 International Hospital. To receive the award, I request Mr. Anas K, Regional Manager, to kindly join us on stage, please. Thank you. Conveniently located in the heart of Dubai, Meteor 24/7 International Hospital is a premium multi-specialty hospital that offers the highest level of medical excellence alongside impeccable standards for patient care. Thank you, sir. Congratulations. Sir, may I please? Oh, okay. Thank you. With increasing cases of hospitalizations, rising bills, it has become very important that we find best insurance policies which not just provides us with the cover we need, but is also affordable and hassle-free. Our next award, Leading Insurance Provider, Healthcare recognizes such an organization. And the winner is Oman Insurance Company. I would like to invite on stage Mohammed Rafi, lead underwriter. Oman Insurance Company was established in 1975 and is now one of the leading insurance providers in the Middle East. Thank you, sir, and congratulations. Promoting health awareness campaigns is our next award category, which shall be bestowed upon an organization that continually designs effective campaigns and spearheads projects to promote and raise awareness on general and prominent health issues in our society. The winner is Tajmil Dental and Medical Center. I would like to invite Mr. Vivek Cherian and Mr. Michael, center managers, on stage. Tajmil epitomizes leadership and innovation in aesthetic healthcare services, especially in the field of dentistry and cosmetology. Thank you and congratulations, sir. Regional Multi-Specialty Medical Center is our next award category. This award recognizes an organization that offers wide array of patient care and services. The winner is Al Kamal Medical Polyclinics, LLC. I invite on stage Mr. Krishnajit, Personal Secretary of Dr. Ajay Kumar, the owner of Al Kamal Polyclinics, to receive the award. Thank you, sir. And congratulations. Moving on, our next award category is Leading State-of-the-Art Medical Center. This award is to recognize an organization that constantly pushes boundaries of healthcare and continually updates their equipment and services in order to offer the latest in high-tech medical care. And the winner is Dr. Sai Ganesh Pillai's Medical Center. I request Ms. Dr. Manju to kindly join us on stage to receive the award. Dr. Sai Ganesh Pillai's Medical Care Center is a modern and state-of-the-art clinic offering top quality healthcare in the field of general laparoscopic surgery. Thank you, ma'am, and congratulations. Our next and final category is Affordable Healthcare Service Provider. This award is being bestowed upon an organization that focuses sharply on making and delivering affordable, accessible, and inclusive health services and taking quality healthcare to the doorstep of the masses. And the winner is Dr. Sirajuddin Medical Center. To receive this award, I would like to invite Dr. Mohammed Sanil, Center Manager, on stage, please. Thank you. Dr. Sirajuddin Medical Center was established in 1991 with the intention of providing quality healthcare in Dubai. This clinic has blossomed as a multi-specialty complex with the aim to provide quality and patient comfort-oriented health services at reasonable charges. Thank you so much, sir, and congratulations. Ladies and gentlemen, please put your round of applause, your hands together for these individuals par excellence for their wholehearted contribution to the medical fraternity. With this, we have come to an end of WMC Organizational Quality Excellence Awards 2019 Healthcare UAE Chapter. I would like to request Mr. Anub Balachandran from WMC to kindly give the vote of thanks. Thank you.
Thank you, Nia. Congratulations to all the winners who are present here at the Ocean Blue Theatre today. It is my proud privilege to deliver the vote of thanks in front of all of you esteemed professionals from the healthcare industry. We are thankful to the President, Vice President, and General Secretary of World Medical Council for such a noble initiative of recognizing the achievements of the industry's most outstanding performers. We trust that the World Medical Council and the organizations present here continue to enjoy the cordial relations in the future as well. A special thanks to all our panelists and moderator for an intriguing session. An event like this cannot happen overnight. We have been fortunate enough to be backed by a team, motivated and dedicated colleagues who have made this event possible. We hope to continue this remarkable journey of honoring exemplary organizations. We thank you for being with us this evening. It has been a great pleasure. On such a positive note, we conclude a memorable evening. Thank you all.
I request all our winners today to please join us at the studio with your trophies so we can all take a group photograph. With this, we conclude a remarkable and memorable evening. We all hope you had a productive event, and thank you for being such a lovely audience. Thank you.